Hi everyone, welcome back to my channel. In this video, we're going to talk about lumbar spinal stenosis. My online client Sarath is going to share with you his experience in regard to his injury. When he's contacted me 6 months ago, he was suffering from multiple level lumbar disc bulges and annular fissure, which has caused secondary lumbar spinal stenosis for him. And he was quite concerned whether should we go with surgery or he should follow my rehab plan. Sarath was not able to sit more than 10 minutes in the initial consultation and he was not able to walk much, but when we start his plan, he was hoping that he can get recovery, but he has so much doubt whether can he recover without surgery. In this video, he's going to share with you how was his situation initially and where is he right now. If you're suffering from lumbar disc bulges that cause stenosis, this video can be hugely helpful for you because you can understand what are the things that you can do. And at the end of this video, I have shared with you series of exercises that Sarath has been doing daily, consistently over the last 6 months, which can be a huge help for you if you're suffering from lumbar spinal stenosis. If you've never been in this channel, my name is Bob. I'm a physical therapist. I help people globally through online rehab plans, and I help them to recover and get back to full capacity without any invasive treatment like injection or surgery. If you have been told to go and jump on the surgery for your lumbar disc bulges or herniation or so on, I believe every person has a chance to recover without surgery if they have a plan and a structure and understand what is the process of recovery. I help many people online, and you can go through my YouTube channel and watch the testimony of people who's been told to jump into the surgery and check and see how they recovered. And I believe you do have a chance if you give it a try. If you would like to discuss more in details, you can book an online consultation with the link below and we can get you started. How did you end up contacting me? Because we've been working now for a while. Maybe you start with that and then we can share with people how you're getting on at the moment.
Yeah, sure. So this injury, this injury with my back, this happened, I guess, last year in the month of August. So but it got worse through the time, right? Like, so by January, it went like it was way too worse. And I've been going through physiotherapists, acupuncturists, like whatnot, like you name it, I've done it over here in India. So I've been going through it, but over the period of time, my situation was getting worse. So that's the time I saw your YouTube videos. So I got to know, okay, those kind of things also exist. And I also reached out to some of your clients. Like, as you know, I talked with you, right? Like, yeah, I reached out to some of your clients asking their opinion on your program as well.
Gotcha.
And then I scheduled an initial meeting with you. And now we have been working for, I think this is the 16 weeks. I joined the 20-week program and this has been 16 weeks, and that's been quite a recovery for me. Yeah.
Yeah, man, I'm delighted. I'm delighted with your progress. Okay, then if I go back to what happened initially, Sarath, like maybe share with people what happened initially. Was it like an injury that you had, or it was just happened just out of like something that you did? What happened?
Actually, with respect to this injury, right, I don't know what exactly happened, but one fine day I was doing some kind of hamstring, like deadlifts, right, in the gym. But after coming home, I got a small cramp in the glute region. And after that, I told you, like, I traveled all over Europe for those 4 months, and I guess that made the situation worse as well because I did not do any rehab, and I did not realize how serious the injury was as well.
I get you.
So by the time I came back to Chennai, it was the month of January. And at that point of time, I was not able to we do the straight leg raise test, right?
Yes.
I was not able to do that. And so I was asked to get an initial MRI. And that MRI suggested disc bulge in the L3 and L4 and L5 S1 region as well.
Got you. Which means you got your MRI in January, basically.
Yeah, in January. One of first MRI was done in January. And that was so multiple disc bulges were there. And after that, I went through physiotherapists. So this also included IFP was there, like dry needling they have been doing, and cupping I was been doing. And initially I was getting better, but after a point of time the recovery stopped. Like once I reached back to my college, right, like I told you, right, I was studying in Mumbai at that point of time.
Yes.
So when I went back, the situation got worse to the point where I was not able to walk as well. So I had to come back to Chennai. I had to take another MRI to see if there have been any more further damages.
Got
And
you.
the second MRI was, I think, in the month of March, early March, I guess.
Mm-hmm.
Yeah, early March. And with the MRI, I consulted some spine surgeon as well. And they straight
Yes.
away told me to get the surgery for this option because I've been going through physiotherapist for almost 2 months. So after this, surgery was the only option. I did not want to do it because that's such an engage. They were also not giving such a good recovery rate. Like they were saying, the recovery rate is 95 to 90%, and you might get a something in the future as well. It might relapse, right?
I
Plus,
get you.
at my age, I didn't want to go through surgery.
Yeah.
And I also tried a different. I have tried almost 6 or 7 physiotherapists before I came to you, and
Mm-hmm.
each one had their own diagnosis. And I also saw acupuncturist as well. I saw Ayurvedic specialist as well. And one final pull was I saw this. I don't know what they do adjustments, right? Chiropractor,
Yes.
yeah.
Chiropractor.
I did
Yeah.
a chiropractic as well. Nothing
Mm-hmm.
worked. But then I had a session with you,
Got you.
and in this session, you are the first person to explain me what is actually happening in my MRI.
Mm-hmm.
You are the first person to explain me my MRI, my situation, the spinal stenosis, right? Like
Yes.
when you explain me what is spinal stenosis, only you told me the exercise I have been doing is wrong. Like I have been doing all
Some of
extension
them,
exercises.
yeah. Yeah. I mean,
Yeah,
they
and
were
that
aggravating your pain as well. Like they were annoying your
yeah,
pain. Yeah. And I
yeah,
mean, basically you mentioned that there were series of exercises that they gave you, and some of them they weren't really helping you. And then we
yeah.
realized that, based on your MRI scan, you definitely have some secondary stenosis because whenever you were doing any extension movement, it was really aggravating your symptoms.
Yeah.
Which is kind of like is still kind of like one of the things that we improved over time. But yeah, okay. Then, Sarath, if I ask you to go back to, let's say, physio treatment that you were getting, were they giving you any exercise to follow besides what we discussed, or how did you find the approach of like getting like a physio treatment? Was it like a manual therapy they were doing, or what was it?
So it was both. So I'll say it was a very intensive physiotherapist. It's not like very normal. Morning I had a set of exercises to do, which takes me around 1.5 hours to complete. And then after
Okay.
that, I used to have IFT treatments or cupping. And then evening again, I need to do the same exercises again, which again takes
Wow.
me say 1 hour. It put a lot of strain on my body. So I guess
Quite
it
tiring.
did help me in my recovery over the period of time, right? Like I put a
Mm-hmm.
lot of morning 1 hour exercise and evening again 1 hour exercise compared to what you gave me, right? What helped me.
Yeah.
That is like night and day the differences.
I get you. I get you. Okay, then if I give you ask you some question in regards to first MRI scan that you got. Okay, they said that there was some bulges, and did you got worry about the bulges? What they told you? Did they explain it to you? I mean, I know you mentioned that nobody really talked about it, but did they give you any feedback what you should do to recover?
So it's one from the spinal surgeon, right? Like this might be hilarious, but when I went to him, I showed him the MRI. He told
Mm-hmm.
me like you can get the surgery done next week, and you can research the own on your internet the advantages and disadvantages, and then come back to me. This was his response. And with
Okay.
respect to recovery, right? Like they told me not to bend forward for a period of at least 6 months, and
Mm,
I need to reduce weight. These were the two things that
yes.
they said.
Yeah.
But yeah, but they said I can't bend forward at all for 6 months. Yeah,
Which is quite stressful as well. I mean, okay, but
we can't
then
survive like that, right?
I know, yeah, but then if you explain for people what was the symptoms were like when you contacted me, what was your symptoms and your condition? How was it in that stage? Maybe let's go through that.
Yeah. So before I contacted you, right, like one of the major from my interaction with you, the major mistake I did was I went to physio in the morning. Then
Yeah,
all through the day I was resting. I was in a sleeping, like lying down
yeah,
position. There was
yes,
not much movement in my routine.
at
And then
all.
again in the evening, like I went to the physio. So when I contacted you, the my initial symptoms were pain was extreme. Pain was to the level of 10, I'll say, from over rating of 1 to 10.
Mm-hmm.
And it was radiating through the calf, till the calf region, it was radiating.
Yeah,
And I was not able to sit for more than 2 minutes at that point of time. And that was the
yes.
major complaint from my end at that point of time. And
Mm-hmm.
walking also, there was not proper form. I was not able to walk for more than 5 minutes.
Yes.
And the pain was intense. Yeah, like from my glute region, right? From my glute, the
Mm-hmm.
hamstring and calf, the pain was very intense, radiating.
Like a kind of sciatica symptoms.
Yeah.
All right, and that symptoms were like for how long like that? Sarah?
So after I started with you, right, like it went down gradually. initially I was not able to sit for more than 2 minutes, but you told me, yeah, you need to, like, once the pain starts, just get up and start moving and then try and sit again. I
Yeah.
guess by the sixth week, right, sixth week, I was sitting for more than 30 to 45 minutes at a stretch,
Yeah.
and the pain was also gradually subsiding.
Yeah.
But
Yeah.
by
Exactly.
now I can sit for more than 10 hours a day. And now I can sit more comfortably without any worry.
Amazing. Amazing. Okay, then, Sarath, if you maybe go back to the first initial consultation, because there's a lot of questions people ask in my YouTube channel that I get a lot of messages from people that they ask me to help them over YouTube, questions. They send me their MRI scan and they or send me their whole report of their MRI scan. Maybe just describe for people how much depth of question that we go through the initial consultation and how much I need to know you to be able to help you, because sometimes people think that I don't care or I don't want to help them. But one of the issues is that most people think this is a very quick fix or quick process, that I do have some magical trick or exercises that I don't give them. Maybe describe how much details do we discuss in the initial consultation and then in follow-ups,
Yeah.
just for people to get some more information.
Yeah, actually, with your approach, right, with respect to this particular injury, right, there is no one size fits all approach, right? Like, it depends on each one's body type, and especially with me, right? When I first consulted with you, you first took into my height also as a major reason. I'm
Yeah.
6'4", so that played a major part, and my weight also, so BMI was also calculated, and
Yes.
also the injury, right? Like injury history, how long has this injury being
Yes.
is that, and how it occurred, if I had any idea. Also, with respect to my spinal stenosis, right, like spinal column cap, you told me there was a genetic issue as well, because usually people have, like, say 12
More
something gap.
space. That's
Yeah,
correct.
mine was very small, so that also played a
Yes,
major issue over here. So
exactly.
yeah, there's no one size fits all approach. Like, it depends on each person's then body type and injury history as well. And the
Yeah,
questioning were very deep. Like, you want, like, even till now, right, there is a lot of trial and error involved in this process. What exercise works,
absolutely.
what exercise doesn't work.
Absolutely. Absolutely. And even though, before the consultation, I'll send you series of questions you to answer. Then in the consultation, we go through more questions.
Yeah.
Then we have an assessment that you basically go through series of movement and exercise that I need to know what you can do, what you can't do. There's no quick fix or like, I suppose, magical box to throw and tell
Yeah.
people to follow. And in regards to, okay, your stress level before the consultation and after consultation, because when you have back pain, you get stressed, obviously, and you get very worried about your back. And if you give a feedback, honest feedback of, okay, how was your approach after consulting me? Because, you consult your neurosurgeon and he said that you can do surgery next week. And that's
Yeah.
quite scary, for most people,
Yeah.
because nobody wants to go under the blade and then do the surgery. There's a lot of, negative and then scary stories out there. And what was your stress level after the consultation? How did you find the consultation?
Which consultation with you, right?
Yes, after the consultation. Yeah.
Yeah, like, well, like before I met you, right? Like, told you, I almost took with almost 7 physiotherapists and neurosurgeons, neurologists as well.
Yes.
I took a lot of nerve tests as well over here in Chennai. The
Hmm.
problem was each one had their own diagnosis with respect to my injury.
Yeah.
And even before, like 1 week before I met you as well, like, they told me to get MRI of my hamstring, MRI of my calf. Like, there was no proper diagnosis till that point of time.
Got you.
And like, they told me, because my injury, right, my
Hmm.
pain is not, I have zero pain in the back. All the pain is in my glute
Yes.
region, right, till now. So they were like, this might be a gluteal, I don't know what, piriformis syndrome, they
Tendinopathy.
said.
Oh, prepare for syndrome. Yes.
So they told me to get MRI for that as well. But after your consultation, right, like, I found that, okay, there is finally someone I can trust with respect to my injury, someone who
Yeah.
knows what he's doing. And with respect to my diagnosis as well, right, like, you told me this is the reason it's happening. And if you follow this particular routine, like, slowly, and there is no very short term fix, this is a lifestyle issue. Over
Yeah.
the period of time, it will come down. Initially, my stress level was high because at that point of time, I had to go join a job as well. So initially,
Yes.
my stress levels were high, but as
Yeah.
I saw some improvement with respect to my sitting time and walking and everything, right, my
Yes.
body changed, and yeah, I gained more confidence over a period of time.
That's amazing, man. That's amazing. Really good. Okay, then, if you now kind of like give people some information about the program, like, let's say like, how did you find the program from the start? Because you obviously were following some exercise before, and then you start to do a rehab with me. How do you find the exercises and the routine that you had? And using the kind of like a metric that we have, the sheet, that you basically put on information there, and you have some sort of information there that you can track them. How was that for you?
So getting back to tracking things was a different thing for me, but I later understood, okay, this is how we see progress, and like any change in our exercise or lifestyle, like that's how we get to know like what to change, what to point out. And initially the exercise, right, like which you gave was quite easy for me, because like you told, I was not as difficult. Like my situation was not very serious, like with respect to other patients. So because I was also been doing other exercise also right before I met you. So initially those exercises were very easy for me, but you also told me very important, like not to overdo it. Like,
Yes.
though I can do it, I should not do it. That's the thing that you said. I should not try everything at particular point of time. Though for the first 6 weeks, we were like slowly incorporating slowly exercises into the routine. You asked trial and error method, like which exercise worked, which exercise didn't work. And slowly we incorporated it. And I think I guess by the 12th week, I was in the gym, and we were doing slowly incorporating cardio into the routine. And now, yeah, I won't say I'm full time into the gym, but we have incorporated a lot of weight exercises as well, right? Dumbbell and flat pull down exercises as well.
Absolutely. And in regards to the timing, for example, Sarath, like you mentioned that the exercise that initially you were doing, it was quite long, and like how much of commitment do you need to do for this recovery? Because obviously a lot of people think, okay, I can join Bob programs, but you have some commitment and duty to do this daily consistently. Like how much of your daily time is incorporated by these exercises, Sarath?
So if you want to get over this injury, right, like obviously it's a commitment that you're giving to yourself. Then that's the thing which will get you over the edge. So the mobility exercise early morning will take me around 20 minutes. And then evening, again, the same mobility exercise will take me around 20 minutes. So you told me to do mobility exercise twice a day. And then in every alternate days, you told me to do some other exercises as well, right? Like according to the schedule. And that takes me, say, to 30 to 45 minutes. So this is the basic commitment that we can give to a body, right? Like if you want to recover.
That's brilliant. And then technically, when you start the plan, every 2 weeks, we have a kind of like a follow-ups, and during these kind of like 2 weeks, you have I suppose, access to me to be able to talk to me, etc. On the phone or send me a message. How do you find that, Sarah?
Actually, that is very helpful, actually, because every doubt I have, like every 2 weeks, right? Like you can clear that. And also in terms of the mistake that I'm doing, like early on, right? Like if I sit in a particular posture, it gave me more pain. So you told me to change the sitting posture, use a cushion or pillow for that. And also you told me, well, with respect to my walking, right? Like I took a fast walking and long strides. You told me to reduce that, and that will help me in the injury much better. So every 2 weeks having that, and also great motivation, right? Like you reinforce that, okay, you can get over this injury. There is a way to get out of this injury, and it takes time. It takes time, but we can do it. Yeah. And that greatly helped me like every 2 weeks.
Amazing. And in regards to, let's say, I suppose part of your plan that you get the diet plan and I suppose food, did you find that helpful in regards to your own energy level and get you back in kind of like full capacity?
Yeah, with respect to a diet plan, initially I found it tough because I was not seeing any changes.
Yeah.
Because the physical activity level was also low, right?
Yes.
So initially I was not finding any changes, but as the time progressed, like my body adapted and I was able to see changes. And especially till now, like though I have reduced weight in the past, I didn't know my protein intake or what are the protein sources and how much to take. I didn't feel much safe.
Absolutely.
But after you told me the whey protein and how to incorporate into your diet, that actually helped me. And with respect to the diet and the routine in general, helped me a lot.
That's great. And maybe sort of just share with people now, like over this now 16 weeks, like what is your symptoms right now in this time in comparison to what he was?
Okay, so earlier on, like in the first week, there won't be, I can't count any days where I did not have any pain. Like constant pain is there, and I can only think of places where I didn't have any pain. Like that will be for a very short period of time. But now my symptoms have come down a lot. I can say the pain ranges from 1 or 2.
In comparison to 10 It was
Yeah,
10 at the start. Yeah.
1
Okay.
or 2. And nowadays I can only think, I need to think a lot when I'm to see when exactly I had the pain. Like
Got
pain
you.
is not that too much.
Got you.
So all the symptoms have come down as well. I am back
Brilliant.
to normal activities. So slowly I'm incorporating into my daily routine. Yeah, I'm back to normal activities.
Amazing, amazing. I'm delighted, man. I'm delighted you progress. You're doing really well. I mean, we are on the stage that we can progress your plan much more, and you're already in the gym, but there's a kind of like a good bit of progress gonna go in this phase of your rehab. And this is a part that I suppose I want to really show people that a recovery of back pain, it takes time, is not quick. And whoever who promised you something quicker, I would not really believe in that, because based on what I see with my day-to-day patient, it's always going to be some challenges in recovery time, and there's no straight line in recovery, which means, and there's more research and study shows that whenever people even recover, there are relapses in future. And by staying active, learning how to build up some trust to your body again, and use your body again, and start to bend again, for example, because I think initially for you was a fear that, should I bend, Bob? You know, is that actually good things to do? But in many cases, people don't realize that if you do not utilize your body and be able to bend and start to utilize and get stronger and build more trust with your body, it is so difficult to see results, even though if you're pain-free. And one of the tips that I really wanted to share with people, I've talked about this before in many of my videos, is that the goal of recovery is not only to become pain-free. The getting pain-free is very important, but for you to become pain-free, that's a very early stage of your rehab. The focus is all about getting you pain-free, improving your overall, I suppose, movement and mobility, and improving your like overall day-to-day activity. But from that phase onward, the goal is to build up strength, get you back to full capacity, build up trust again, and get you to the full function, which means being able to bend, squat, lift, twist, and do things that you used to do. And in many cases, people have hobbies and things that they want to do, but because of their back, they've been told to don't do them because they believe that their back is very fragile, it's going to get sore again, and they're always avoiding them. And that's a worse scenario. And I really want to repeat this again, that definitely try to get the right rehab plan if you are having back pain, and do not settle to just only get pain-free, because that's not the goal. You need to challenge yourself and face your fear. Sarath, I'm really happy with your progress. Is there anything else that, like, let's say, that you like to share? And I always ask one question for my patient, is that I wanted to ask them to share their top tips for people who's watching this video. If you were going to share your top tips with somebody who has a similar injury with you, if you share 2 or 3 tips that you think was beneficial for you, what would that be?
Before getting to that, you told right, like people tell like you should not do this particular thing at all. Yeah, that kind of thing happened to me as well. I was told not to ride bike at all. But then I asked you like whether I can do it. You told me like we won't know until you try, right? So
Yeah.
I started doing it, and I felt like, okay, I gained more confidence over time. Okay, this is something that I
Yes.
can do. My
Yes.
body has recovered till that point. So that is the thing. So with
Yes.
respect to tips, right? Like one is following your routine, like knowing what to do every single day, like what are the exercises that we should follow,
Having a
and
routine.
having a routine, that is, and having you for clearing any doubt as well. Like, okay, what is something that I'm doing causing me more pain, or is
Yes.
something that can I change in my routine? And
Yes.
2 is having a diet plan, because like you said, reducing the weight like
Yes.
has helped a lot, will help a lot in the recovery as well and in the long run as well. And since the first
Absolutely.
you made it clear that getting like pain free is not the goal, but getting me fitter and back to the place where I used to before the injury, right? Getting me back to
Exactly.
that place
Getting
was the,
healthier.
yeah, was the goal till the end. Yeah, like when I'm, this is the something that I want to share, that is like this is not a very short kind of recovery. It is something that will going to take long, because the injury period as well, like it to worsen it to this state, right? It will take a long period. Recovery
Absolutely.
also takes equally long, if not longer. So having
Absolutely.
someone to guide you through the process is something very important.
100%. 100%. Listen, thank you so much for the time. I'm delighted to see you getting back in action. I'm going to share some of your video with people in this video, and we may have some more update in future and get you back to full capacity. And you're working around to get back to work. All the best with that process, and anything else that you'd like to share, Sarath?
No, that's all from my end.
Excellent.
Yeah.
Listen, delighted with your results. Keep up the good
bro.
work, and I'll chat to you soon, man. All the best.
Sure. Bro. Yeah.
The first move that I'm going to share with you guys is going to be figure 4 stretch in a seated position, which means you're going to cross the leg. Let's say the right side is the affected side. You want to just simply cross the leg. By doing that, you already might feel the stretch. If you need a little bit more, you can apply a little bit of pressure, lean forward on it, hold it there to 5, 10, 15 seconds, but don't really beat them up too much. Try it for both sides. Getting your hip open up hugely can help you to walk, move, or sit easier. You can hold it there 10, 15, 20 seconds. Try it for 3 to 4 rounds through the day. The more you do that, this movement becomes much easier and you can sit on it much more comfortable. The following move is going to be nerve floss in a seated position. If, let's say, we presume the left side is the affected side, we're trying to floss that hamstring and basically sciatica nerve. There are two movements. There's one, you're extending your knee and you extending your neck at the same time. You want to do them together. Go within a range that feels comfortable. Your knee might not come all the way up. Go within a comfortable range. Do not force it. I'm going to show you again. Slow control down. Use your hands. Balance yourself. While you're doing this, avoid too much force. Go within a comfortable range. If you decided to do it for the other side, you can definitely do it on both sides. No issue. All the way up, slow control down. Try this exercise as often as possible within a comfortable range. The following move that I'm going to show you guys, after you practicing the first 3, you want to get back to some sort of forward flexion, which means you want to relax your back. Forward flexion is hugely important to reintroduce as quick as possible as part of your recovery. Despite the fact a lot of people talk about do not flex your back or don't bend forward, it is absolutely rubbish. Why? Because we need to flex in some stage in life, and you cannot avoid flexing. Now, in this movement, you start flexing is from a seated position, which is less provocative for your back, and you can gently go all the way down and come back up. Go within your range, don't force it, relax your back, get some support, breathe in and out, and come back. Now, if you find that is too much, you can simply just lean forward on your elbow for a while, 10, 15 seconds, and go back. Now, practice that for a couple of days, then try to move your arms down the leg. That would be a nice progression to get you that flexion and extension back into your lower back. Trust me, practice this exercise and you can see much quicker recovery. It's going to be seated squat, which we're going to try using a box or a chair to give you a slight amount of support. With a box squat, you can literally perform the squat movement without aggravating your pain. Now, if you find that you need a bit of cushion underneath of your seat, you can try something like this and get the seat a bit higher, and you don't need to perform the full squat. If you find this exercise is easy, the advanced version of this routine, which is the resistance band, you can see on the side. We're going to try that for 3 sets of 8 to 10 repetitions. The last exercise, guys, that I'm going to share with you guys is the progression of those few that I showed you earlier. You need a book or something that you can put underneath of your heel. This is the kind of heel support I'm using. These are kind of like a sand dumbbells. I'm going to just keep them underneath of my heel to give me a little bit more mobility to get down to a deep squat. Now, if you've never done a squat before, you want to practice those few initial exercises first and gradually build up to this movement. But this is an amazing exercise that you can do that hugely help you to elevate that lower back pain and sciatica. You want to be shoulder width apart, which means feet shoulder width apart, toes are slightly out. You want to use a book or something underneath of the heel, like a plate. And we try to gently go down to that squat movements. Now, I'm going to show you, you don't necessarily need to go all the way down. If you find that you can go only up to here, That's fine. Come back up. Over time, you want to gradually build up that movement that you can go a little bit lower. Go within a comfortable range. And when you got to the chance to get to this point, you want to drop down the shoulder, drop down the lower back, adjust the heel. Make sure that you get good support from the heel support and you relax your back. This position hugely helps you to stretch and get more mobility on the hip, on the lower back, and is a neutral position for our spine. Your spine needs to move, get to that flexion and extension. Stay there for 5, 10, 15 seconds. Slowly come out of it. Give yourself a little bit of time to be able to get to that squat. Now, if you need to balance yourself with things, use a wall, use a stick, like use that to get you there and use it to come back up. Don't hesitate to use that. In the kitchen, you can use a kitchen cabinet, something that you can hold on to it, which means if you've gone all the way down, you don't stuck. Practice this exercise daily 2 to 3 times for 3 sets of 8 to 10 repetitions within comfortable range. When you're at the bottom of the squat, you want to be able to breathe in and out and relax your back. Thank you for watching this video. If you have any question regarding your injury, you can leave me comments. If you wish to get a second opinion, you can book your online consultation with the link below, and we can go and review your injury and answer your question regarding to your problems, review your MRI scan, and give you a second option in regards to your recovery instead of surgery. I believe many of back pain and majority of them are able to recover without surgery and through a conservative treatment if they have a structure and a plan in place that can measure what they can do and what they can't and gradually build up more capacity. If you would like to see more testimonial, you can watch my YouTube channel and check my clients globally how they recover through basically following a rehab plan online. If you find this video helpful, please share, subscribe, and like this video with your friends and family who you may think get benefit from watching this video. By supporting my channel, I can grow my channel and help more people like yourself who suffer from back pain with some sort of tips and rehab exercises to recover. Thank you so much for all your support. Until next week, all the best.